All right, let's get right into it. Cancer vaccines. They're here, they're real, they're FDA approved, and they are being used to treat patients literally today. But, and this is a big but, they are almost definitely not what you think they are. The name itself is one of the most confusing terms in all of modern medicine, and it creates a ton of misunderstanding. You know, as a pharmacist, I hear some version of this question all the time, and honestly, it's a perfectly logical question. We hear the word vaccine, and our brain immediately goes to things like the flu shot or the measles vaccine, a quick jab to prevent us from ever getting sick. But when we're talking about cancer, you basically need to hit the reset button on that entire definition. So here is the absolute most important thing to understand. Traditional preventative vaccines, they train your immune system to fight off an invader before it can ever cause a problem. They're like building a shield around your body. Most cancer vaccines, though, are what we call therapeutic. They are a treatment for cancer that a person already has. They don't build a shield, they're designed to unleash an army. And this represents a massive shift in how we think about treatment. I mean, think about it like this. It's the difference between teaching a security guard what a burglar looks like before they break in versus pointing at a burglar who's already in the house and yelling, "Get that guy." That is exactly what a therapeutic vaccine does. It points out the enemy that's already snuck past your defenses. Now, of course, there are two really famous exceptions to this rule. The HPV vaccine and the hepatitis B vaccine absolutely do prevent cancer, but it's so important to understand how they do it. They don't actually target cancer cells. What they do is prevent the underlying viral infection, the HPV or hepatitis B virus, that can over time lead to certain types of cancer. They stop the cause long before the cancer itself can ever develop. So if these new vaccines are a treatment, how in the world do they actually work? Well, your immune system is this incredible, powerful fighting force. The problem is, cancer cells are just masters of disguise. They are incredibly sneaky. They can make themselves look like normal, healthy cells, or even send out signals that basically tell your immune system, nothing to see here, just move along. So how does this whole training process go down? Well, first, scientists identify these unique little flags or markers on the surface of the cancer cells. We call them antigens. Think of it like figuring out the enemy's uniform. Then, they create a vaccine that basically shows these markers to your immune cells. The vaccine is like a training manual. It's saying, hey, immune system, this right here, this is the bad guy. I want you to go attack anything that looks exactly like this. And just like that, your body's own natural defenses are now equipped to see right through the cancer's camouflage and finally go on the attack. Now, because this approach is so new and so different from what we're used to, a lot of myths and misconceptions have popped up. So I think it's time we clear the air and bust some of the biggest ones that I hear from patients and their families. This is probably the biggest one, the most common misconception. This idea that a cancer vaccine is some kind of universal one-size-fits-all cure. The reality couldn't be more different. These treatments are the complete opposite of one-size-fits-all. They are incredibly specific. A vaccine that's designed for a certain type of skin cancer will do absolutely nothing for prostate cancer. In fact, some of the most exciting research right now is in personalized vaccines, which are created using a patient's own tumor cells to train their immune system to fight their very specific cancer. It's truly tailor-made medicine. The second big myth is that this new treatment is a replacement for the old ones. You know, a way to just skip chemotherapy altogether. But that's really not the case, at least not yet. It's better to think of a cancer vaccine not as a solo superstar that's going to win the game on its own, but as a really valuable player on a team. It's another powerful tool in an oncologist's toolbox, and it's often used right alongside, or maybe after, chemo or radiation to make those treatments work even better, or to hunt down any stubborn cancer cells that might have been left behind. This one makes sense, right? It comes from our experience with treatments like chemotherapy, where we've been conditioned to look for really rapid, sometimes dramatic results. But you have to remember, with a vaccine, we're not just carpet bombing the cancer cells anymore. We are training an army from scratch, and that takes time. The immune system needs weeks, sometimes even months, to build up its forces, get organized, and launch a full-scale, coordinated attack. This is a much longer game, and believe it or not, patience is a really important part of the treatment plan. Okay, so now that we've busted some of those myths, let's look at where this incredible technology is actually making a difference for people right now. So these are some of the areas where we've seen the best responses so far. It turns out that cancers like melanoma, which tend to have a lot of genetic mutations, actually give the immune system more unique targets to lock onto, and that makes them really good candidates for this kind of vaccine-based training. This was the big one, the landmark. Sipuleucel-T, which has the brand name Prevenge, was the very first of its kind to get the green light from the FDA, and it's an incredibly personalized treatment. They actually take a patient's own immune cells out of their body, send them to a lab where they're activated with a protein found on prostate cancer cells, and then they infuse them right back into the patient, totally ready for battle. And here's the result. In the clinical trials, this treatment extended median survival by 4.1 months. Now, I know what you're thinking. That might not sound like a huge number, but for men with advanced cancer that had stopped responding to every other treatment available, this was an absolute breakthrough. It was the proof we needed that this whole concept, training our own immune system, could actually work. So let's bring this all home. Let's translate this science into some practical advice. If you or someone you love is navigating a cancer diagnosis, understanding this new world of treatment is really critical for having good, productive conversations with your doctors and nurses. The most important takeaway here is all about how you frame the question. Just shifting your language from, is there a vaccine for my cancer, to, are there any immunotherapy treatments, including vaccines, that might be an option for me? That opens up a much wider and frankly more accurate conversation. It includes vaccines, but also a whole class of other amazing drugs that work with your immune system. It's about asking the right question to get the best possible information for your unique situation. It really all boils down to this one simple but incredibly powerful idea. This quote just perfectly captures this huge philosophical shift in cancer treatment. For decades, the main strategy was to poison the cancer with chemo or burn it with radiation. But now we have a third pillar. We can empower our own bodies to recognize and destroy the disease from the inside out. So, the next time you hear someone mention a cancer vaccine, don't picture a simple shot you get at the pharmacy. Instead, think of it as a sophisticated, high-tech training program for the most powerful and personalized fighting force on the planet. And it leaves us with this really powerful thought. What if the cure we've all been searching for has actually been inside of us this whole time, just waiting for the right instructions?